Hello, my name is Hector Ayala. I am with Injury Prevention. I'm an Injury Prevention Supervisor. We're going to do a quick demonstration on how to safely turn a patient using lift equipment. Step one, we're going to level out the bed and raise it to the appropriate height. We're going to turn the patient over to this side, so we're going to use the hover mat and slide the patient to the opposite side. What we're trying to do is create space so that when we turn the patient onto their side, we have the space needed so that they're not up against the rail. Okay, we're still going to follow all safety procedures here that we have to do. So we're going to stop, lock, and look. We're going to have somebody in a position of safety, and we're going to have somebody operating the pump. I'm in the position of safety here. So we created the space that we needed to turn the patient. So now what we're going to do, we turn the pump off. He has his position of safety over there. I'm going to show you over here how to attach a portable ceiling lift to the ceiling track without raising the device. Okay, so I have the power on here. We're going to put a little tension on this strap here. So what we are doing is making the strap long enough to be able to reach the ceiling track up above. So now we have the slack that we need to attach it without lifting the ceiling lift. We'll put a little bit of tension on this, and now what we're going to do is press the button so that the lift can raise itself up. So as you can see, we did not have to lift this up to attach it to the ceiling track. What we're going to do is slide it over to the side where we're going to be lifting. We're going to attach the ceiling lift to the handles on the hover mat. If you can show them the hover mat handles there right quick. Okay, but one thing we have to make sure is that all of the system is lined up. The ceiling lift has a tilt switch on it, so everything must be aligned. It cannot be off alignment or else it will not operate. We're going to push the bed and we're going to align the track pretty much to the waist of the patient here. So we'll raise the bed up. Excellent, that should be good there. Lock the brakes and he's going to attach it. So as you can see, we're aligned here. Everything is nice and aligned. So the next step here, I'm going to just slide the patient's leg to the center a little bit, and we're going to begin turning the patient onto their side. To balance the patient, all I'm going to do is slide the patient's leg forward a little bit, and this balances the patient. So now he can lower the ceiling lift there. And at this point, we detach the portable ceiling lift here from the hover mat. We'll get this out the way, and at this point the nurse can attend to wound care or clean the patient up. Once we're done cleaning, we're going to take the old stuff and we're going to fold it up. In the event that we have to change the hover mat because it is soiled or not lined up properly, what we do is we fold up the old hover mat and then we're going to place the new hover mat. Now, when we go to place the new hover mat, it's important that you place the hover mat by itself, separate from the sheets. The style that we're going to use is an accordion tile fold, accordion style, there, okay? And then we're going to tuck it underneath the patient as far as we can, and of course we're going to make sure that the hover mat is lined up to the patient appropriately and to the bed. Okay, and what we want to do is try to tuck the new hover mat in as far as we can underneath the patient. Okay, so before we put the sheets on, we want to make sure everything is lined up. And remember, when using the hover mat, all you need is a flat sheet and chucks, no draw sheet. Okay, once your sheets are all placed and your chucks are placed, now we're going to place the patient back on their back. Simply just take the leg and slide it back and return the arm. So the next step here, we're going to take the portable ceiling lift again and we're going to attach it to the hover mat on this side. At this point, we are not going to do a full turn. All we are doing is attaching it to the hover mat so we can raise it up a little bit here to get access to the new one that we installed. There you go. As you can see, the new one that we placed here, you can simply pull it out. This is why we do the accordion lay on the hover mat, so that we can easily pull it out. If it was rolled, it would be completely difficult to get this out from underneath the patient. So it's important that we use the accordion fold. All right, so now what we're going to do is we're going to lower the ceiling lift. We are going to disconnect it and get it out of the way for the moment, because the procedure now is we're going to turn the patient over to the other side. So we're going to have to attach the hover pump again to slide the patient over to create the space needed for turning the patient onto the other side. So notice that I am attaching it to the new hover mat. Not the old one, the new one. We have the position of safety, stop, lock, and look. Make sure we have slack on all the lines and everything. And we're going to use the slow setting here to inflate the mattress. Excellent. So we provided the space that we needed for turning the patient onto their side. So we are going to attach the ceiling lift now to the new hover mat. And then we are going to turn the patient on their side. So at this point, we can detach the hover mat pump. And if you need to follow up on any cleaning, you can do some cleaning here. Take your soiled sheets, fold them up and get them out of the way. Take your new sheets, unfold them, your chucks. Then what we're going to do is raise the sheet up and we are going to wedge the patient. And this concludes turning with equipment here.